Hi everyone. So it is Friday evening, and I just recorded my weekly pregnancy update for my other channel, and thought that I would do a quick video here because I finally have everything for the newborn testing for the baby at birth, and I kind of just wanted to go over what I have and what the plan is for anyone who might be curious, and maybe we'll be going through this at some point in the future. So first of all, we're going to be doing testing for Lyme and Babesia through IGeneX in California. And I just got the kit and everything yesterday when I saw my doctor, and basically there's like a whole bunch of papers and stuff in here that don't really apply to my situation or to the testing that we're doing or anything like that. So I'm not even going to bother going through that. But so there's, and this is going to be backwards, I'm sorry, my camera that I'm using flips things. So there is, shoot, my doctor's information is on here. There's this form that it comes with that my doctor had to sign and kind of fill out one area, and then on the back there's like a list of all the tests that they can do, and they don't actually list the testing that we're going to need to have done, which is unfortunate. Like, I feel like they should add that on. They should add on the newborn testing stuff. But basically we're testing a sample of the placenta for Lyme and Babesia, and we are testing a sample of the cord blood for Lyme and Babesia. And both of those are going to be, I believe, through PCR. It actually doesn't say. No, it is. Yeah, it's all going to be with PCR. So, and if you're not familiar with what a PCR tests, it tests for the actual DNA of the bacteria. So, if it comes up positive, it's really accurate. It is obvious, it's of course difficult to find the DNA in the sample. The cord blood probably won't be as likely to show it as the placenta, because tissue tends to have more of the bacteria in it. So anyway, so that's that. And then this is the box. And it's just a little box. It also comes with a FedEx bag to put it in, and there's a FedEx shipping label in here, so that it's all set. I just have to fill out my return address. But it's like, the shipping is therefore included in what you pay for. So there's this box. Inside the box, sorry, this is a cord. Wow, I'm throwing things around. There's a little cold pack in here that I imagine I should throw in the freezer now, although I'm slightly concerned that I'm going to forget it when we actually leave for the hospital. I'll have to write myself a big reminder or something. But I'll put that in the freezer so that it's cold when we go. The hospital can also probably freeze it, because we probably won't be shipping it out immediately. And then it has the test tubes. And I don't know what is going in what, but there's 2 red-topped tubes, one red and black, a purple-topped tube, and then I believe this is what the sample of the placenta is going to go into, because it has a screw-off top. And then it also has this styrofoam container, which is, I actually haven't opened it, where the test tubes will go for the actual shipping of them. So that's the kit. Someone at my doctor's office spoke to someone at IGeneX to find out what the procedure and everything is, especially for the placenta sample. So there's also a little note that is included in here, just kind of with instructions of how to handle the placenta sample. So it says, place in sterile red tube and box, freeze, ship with frozen cold packs along with cord blood sample. So hopefully the doctors know what they're doing as far as this goes. I will be talking with them. I have my next appointment with my OBs on Monday. So, oh my God, he's kicking all over the place right now. So I have my next OB appointment on Monday, and so I'll go over it with them and everything and make sure that, we're all set for it and they know what to do. I don't know if I'll bring the kit with me on Monday or not, but, hopefully it doesn't seem like it's a problem. I've brought it up with them before, and excuse me, and they haven't had any concerns about it, so, hopefully it'll all go smoothly. And yeah, so that is the newborn testing kit from IGENX. And so we'll see if the testing shows anything. Obviously I'm hoping that it doesn't, and I'm hoping that it doesn't show it because there's none of the bacteria present, and it hasn't passed. But if it comes back showing something, then we deal with it, and there's not a whole lot I can do about it right now. So there was something else I was going to mention about this, and now I can't remember what it was. I don't know how much the testing is going to cost. They don't have information on their form about testing tissue. So they do somewhere they had listed the newborn testing, which is just of the cord blood, and I think it was 200 something to test just for Lyme. So my guess is that this could be somewhere, I hope it's less than $1,000, but it could be around $1,000 for the testing. Don't quote me on that, though. I really have no idea. But we are testing for both Lyme and babesiosis with both a sample of the placenta and a sample of the cord blood. So all of that combined, of course, makes this much more pricey than, we could just be testing the cord blood for Lyme and just call it a day at that. But trying to be as thorough as possible. Yeah. So that's pretty much that. I'm going to stop rambling on because I don't really have anything else to add to that. If you have any questions about any of this, I don't know a ton about the process and everything, so I can't necessarily answer all kinds of questions right now, but I'm certainly happy to try to, and I'm definitely happy to answer questions afterwards, after the samples are taken and, after the testing comes back. And I will certainly be doing more videos to share that information as I go through this. So that's it for me for today, and hope you're all having a good week, and I'll talk to you again soon.